Hello, my name is Alexandra Fotaki. I'm diplomatic editor of the daily newspaper Tanea in Greece, and we would like to welcome you to one more web discussion that is organized in the context of the Greek chairmanship of the Council of Europe. Today, our invited speaker is Professor Frank Snowden from Yale University. Before we start the discussion, the chair of the Committee of Ministers of the Council of Europe and alternate Minister of Foreign Affairs, Mr. Miltiadis Varvitsiotis, will give us some brief remarks.
Ladies and gentlemen, good afternoon to all of you. It's a pleasure to welcome you once again in our digital discussions with prominent personalities in the framework of our e-chairmanship. You know, Greece is holding the chairmanship of the Council of Europe, and within the various discussions that are taking place, we have asked prominent personalities from all over the world to come and comment on the main theme of our chairmanship, which is no other than the COVID-19 pandemic, and the effective response to that pandemic from the view of the democracy, rule of law, and human rights. As you know, we have already discussed with Bernard Levy, and we have discussed with Mr. Tsiodras, who was the coordinator in combating the pandemic. Today, we have the pleasure to welcome Professor Snowden among our guests. And I couldn't find anyone more relevant to talk to us about the pandemic and the effects to the society other than Professor Snowden, who has already published a book called Epidemics and Society, from the Black Death to the Present. I think it's very important to highlight the view of Professor Snowden on the issue that contemplates our theme of the Greek chairmanship. Our theme is effective response to a pandemic from the view of the human rights, rule of law, and democracy. And I think that Professor Snowden will focus on the issue of how the societies have reacted and suffered through an epidemic. Dear friends, it's our obligation to the future generations to leave them with the guidelines of how to deal with any future epidemic. And since the COVID-19 epidemic is not over yet, I think that's also relevant for today, to have basic guidelines on how to respond to this pandemic in full respect of the human rights, democracy, and the rule of law. And that is the aim of our chairmanship at the framework of the Council of Europe, to issue a declaration, for the first time, a legal document comprising all the values and all the responses that should be adequately dealing with the pandemic, but in the same time, in full respect of human rights, democracy, and the rule of law. I would like to thank Professor Snowden for accepting our invitation, and I would like to welcome also the prominent foreign correspondents of the well-known Greek newspaper Tanea, Mrs. Alexandra Fotaki, who is going to make this interview much more lively and interesting. Thank you very much.
Thank you, Minister. Professor, welcome.
Thank you. I'm very pleased to be with you. Thank you for inviting me.
First question, I will start from your book's title, Epidemics and Society, from the Black Death to the Present, and I would like to ask you which are the effects of the pandemic of COVID-19 to the society, and how worried you are.
Right. COVID-19, I think, is become causing a tectonic shift in our world. I believe that it's extremely consequential in terms of its effects on the economy, on inequalities in society, inequalities between the global north and the global south. It has promoted a wide variety of internal divisions within society. It has increased the inequality in many countries between men and women. It has increased the poverty of poor people. It poses the threat of international hunger and famine. It leads to it has caused fractures internationally within the European Union with regard to policies to be adopted towards this. It's created enormous problems throughout the Americas, in Latin America terribly, also within the United States, as we're seeing now, as it's becoming this victim of this huge surge. It's created raised questions about law and legality, about so I would say that I'm very worried about this pandemic, and not least because I think that we are at the moment in an early stage of it, and I believe that we're really only at the beginning, and that this is a disease that's likely to become recurrent in a number of waves. It's also likely to become endemic. And the recent discovery that it does not confer immunity on, or at least not a lasting or reliable immunity on those who have already suffered from it, makes it seem less likely that a vaccine that will be developed will be very efficacious, and therefore, and we also don't have a therapy, so we have only at the moment testing and social distancing as means to contain it. So I think that we're likely to be dealing with COVID-19 for a long time, and that it's going to transform our lives as we're going to have to live with it internationally, and also domestically, and in communities and personal lives. So I see this as a transformational time.
You talk about poverty and unemployment and economic crisis. Do you believe that the international community is prepared to confront this and to help people?
I would say very certainly not. One of the unfortunate features of pandemics is that they seem to reveal ourselves. They reflect back to us our priorities, and some of the things that we're seeing are not beautiful. And among those is lack of respect for science. This is an event that was forecast by scientists. It did not take the world without warning, and yet there seems to be in political leadership a desire to find priorities for spending other than those of public health. And so around the world, the last number of years have seen not preparedness, but its opposite. That is, cuts to ministries of health, budgets to healthcare systems. All of this, there was no surge capacity within the health system. So I see that we were not prepared. It's also true that the World Health Organization, which is the organization that should be able to be responsible for coordinating an international response, unfortunately, it was not placed in a position of being able to do that. It doesn't have the funding and the political support, and therefore the strong internal infrastructure to enable it to assume that role. And now we see that the United States, one of the most important members, is withdrawing, which I see as a disastrous and politically motivated decision. So I think that that's another reason for being quite worried, is the international capability that has been undermined during this pandemic, and the questioning of that also there's been the rise of nationalism in many contexts and at the expense of the unity of Europe or international solidarity. There hasn't been an acceptance of the fact that we are a global world and whatever happens anywhere will affect the entire world. And that perspective has not been accepted yet. And the insights of science have been severely questioned. So those are very concerning aspects of this disease.
So in the 21st century that we should say that health is right, we are not able to predict the pandemic, to prevent it, or to be able to confront it.
I would say that I agree with most of what you said. The only thing is that we were able to predict the coming of a pandemic. Indeed, one of the shocking features here is that virologists and epidemiologists since 1997 have been predicting that there would be a pandemic challenge. They've even said, for example, Dr. Fauci testified before the United States Senate in 2005, in which he said that it was like the analogous to meteorology. Meteorologists could say to someone who lives in the Caribbean that a hurricane is coming and that it would be very unwise not to prepare. They couldn't say when the hurricane would come or how strong it would be, but it was certainly coming in the near future. Similarly, he said, it's the same with virology, can say that a pulmonary virus is inevitable in our future, he said in 2005, and we would be very foolish if we did not prepare systematically to confront it. So we knew that this was coming. Our major scientific experts predicted that it would come, and now it has come, and we were not prepared. As a world and as individual nations, we did not take the steps that were necessary to equip ourselves to cope with this. And so, yes, the COVID was an act of nature in part, but we have magnified its impact. It did not need to have necessarily an impact and to cause as much suffering and death as we're seeing unfolding in the world now. That is partly generated by the failure of policy and preparedness.
You have mentioned about the US and Latin America, and I would like your comment about the stance and the reaction of certain leaders, for example, Donald Trump and Mr. Bolsonaro, and your comment about Europe, because even in Europe we had anxious that maybe we have some leaders who are going to take advantage of the situation and try to go to more, I would like to say, more extreme measures that we need to.
Yes, I'll start with the last point that you made, and I assume that you're referring to Hungary and Poland, and those are two countries that very clearly have made use of the coronavirus in the sense of heightening nationalism and questioning the unity and democracy of Europe, and putting on the agenda internal political power moves that strengthen the authority of the executive. That I see as a very perilous course to take, and it, rather than unifying the European Union, which is what is needed now, it undermines that unity and puts its democracy in question, in peril. With regard to the United States, I think that we have seen catastrophe that did not need to happen because the United, why? It's deeper than just one man. I agree that President Trump has provided no leadership in the time of crisis, but it's not simply that. It's also, there's a longer term disrespect for science. The Republican Party is one of the world's few ruling parties that does not accept Darwinism and does not accept climate change, which are essential to a scientific understanding of the world, and has rejected science and has stoked the falsehood that this is somehow an Asian or a Chinese virus, as if there was something in the DNA in China, and so it's used that to stoke xenophobia. We also have in the United States fractured leadership between the president and his advisors and 50 state governors. And also then we have municipal authorities, departments of health, school boards. So what we've had is not a single messaging, but a cacophony of sound, a symphony without a director, shall we say. And the result of this has been utter confusion, utter contradiction of policy, which is one thing in one county within a state compared to the next county, and then one state versus another, so that the general public is totally confused and doesn't know what to believe and what to think. I contrast that messaging with I was experienced COVID-19 by living in Rome for 6 months at the height of the Italian experience. And what was very striking was, I don't wish to make a heroic declaration of Italy. I just want to say that it was very different from the United States. Giuseppe Conte, the prime minister, announced what measures were needed to be taken, and they were taken throughout the country. They were quite strong lockdown measures, but they were explained in careful terms to the population. This is the only weapon we have. It is all we can do if we want to protect the nation, ourselves, communities, our relatives. All of that is essential. And this message was unified and was on the television, on radio, posters on the wall. Department of Health vans went through neighborhoods to explain this. The result was compliance on an extraordinary scale for a prolonged period. Indeed, Il Messaggero, this local paper in Rome, said that this was the first time in 3,000 years of Rome's history that the Italians had been obedient. And I do believe that there is certainly truth to that, and it's a polar opposite from what happened in the United States, where there were revolts against the healthcare measures. And I think that is partly the problem of lack of poor messaging, ununified, unharmonious messaging, and internal conflict and lack of science. So I see the American response has been chaotic, as opposed to, let us say, the Italian response. I could say other European Union countries, Greece, Germany, and others. So it's not simply Italian, this contrast. There's a very striking contrast, though, between, you mentioned also Bolsonaro in Brazil, and we see that he's very much along the same view of science that Donald Trump is. And I think that Brazil is paying a tremendous penalty for not being able to organize a coherent, science-based response to the disease, which is what is responsible. The world, by the 21st century, has an enormous series of public health understandings and of science, and of scientific medicine, and it has been unable to deploy those effectively to confront this terrible challenge. That is part of the irony, the bitter irony of our situation.
In the economic crisis, we had extreme cuts to the health domain. You have talked about disrespect of science.
Yes.
Those two things together can lead us to populism, and how dangerous is this?
This is extraordinarily dangerous because the populists, let me see, in Italy or in France, I'm thinking the Five Star Movement in Italy, Le Pen in France, say that this is a disease that is brought by immigrants. And we see populism in the United States, in the Republican Party, very much saying this is, they even use derogatory terms to describe the virus, the Kung flu, which is hideous as a term, and describing it as this. All what that does is it's rejecting the World Health Organization very carefully collected a group of scientists to devise a term for which was COVID-19 because it's scientifically accurate. Calling it the the Chinese flu is a rejection of the consensus opinion of the international community of science. And that has many, many implications, one of which is a terrible misdirection and misallocation of resources to build walls where they are not effective. Viruses do not respect walls. It's also untrue epidemiologically, and so it misdirects the efforts of epidemiologists to understand this virus and its successors in the future, to say that this is an Asian flu, that it's associated with immigration, when those are simply not true. And it means I'm very much hoping that in the public health realm, future generations won't look back and say that the Trumpian wall was the metaphor for our public health response, because that's a very dangerous response, and it doesn't deal with the underlying causes of the dissemination and spread of this disease.
Do you think that Europe should take especially measures to confront this, and so we will not turn to a society of isolation and close borders, nationalism, and racist?
Yes, I very much hope that that will be the direction that Europe takes, and this will be a silver lining in a very dark cloud. And I think that the United States clearly is not providing leadership. And I think what a wonderful thing then if the European Union provided that leadership for a correct, scientifically directed and honest, ultimately, way of confronting this disease and those vulnerabilities in our midst that are driving it forward. And I think what needs to be said is that epidemic diseases have triggered all sorts of political responses across the political spectrum. There is no inevitability as to the impact politically. It's a matter of moral choice. Our responses are the disease does not have agency. It's human beings who have agency, and we have the possibility of adopting either the measures that our brighter lights, that is, science and intelligence and humanitarian feeling, direct us to, or else we can allow the darker sides of our nature in terms of xenophobia, racism, and authoritarianism. That is a moral and political choice, not an inevitability. I would say I have some grounds for optimism in the long term because I do believe that one of the features of this is that we are dealing with nature itself, and one cannot bargain with nature or explain it away, and it will have the disease will continue if it's not dealt with properly, and those who adopt mistaken policies, I think those mistakes will be very quickly exposed, and I think we're seeing that in the United States at this very moment. So if you were to ask me, do I expect wonderful developments politically to emerge from this? I would say in the short term, pretty definitely not. Certainly not in Brazil or the United States. But I think in a longer term perspective, we will have to learn to live with this disease. And so people are beginning around the world in different places to reimagine what the economy and inequality and healthcare systems, internationalism, all of these issues, what cities would need to be look like, how they should be reconfigured to help deal with having to live with this viral presence in our midst. So I have a sort of long-term quasi-optimism and a lot of pessimism for the immediate future.
So you think that this pandemic could teach us to respect human beings, health, the right to health, and our environment better than we did in the past?
Absolutely, that is my greatest hope. And I think that what's happening, for example, in the United States, but also elsewhere, it's a bigger problem than that, is the lack of health as a human right. And in many places, therefore, health as for profit. And we're seeing the way in which that actually drives the pandemic, because not having access to medical care is a driver of the disease. And so it's not only a plea for humanitarianism, although I don't see anything wrong with that. Humanitarianism is wonderful and important, but it's in addition to that, simple prudence would dictate that if we don't care for the most vulnerable people in our midst, we as a world and we as individual nations put ourselves at tremendous risk, because the disease, as we're seeing now, preferentially targets the vulnerable. And so if we don't protect those people, then the world as a whole is going to suffer and suffer needlessly from this pandemic.
We see also a diplomacy in the context of to confront COVID-19. Do you think that this could change the world and to create new alliances, maybe?
Well, this is a possibility. One fears many of the geopolitical possibilities and implications that are possible. One sees the inflammatory relationship between two of the world's greatest powers, China and the United States, unfolding partly as a result, exploiting this emergency to weaken each, to weaken the other. That is an extremely unfortunate result when we need internationalism rather than nationalism. But on the other hand, it is possible that one of the results of this will be a change in the relationship between the global north and the global south. It may be possible that, for example, debt forgiveness of countries that are struggling with this emergency without resources, the terms of trade. There are many gestures of international solidarity. The Netherlands has discussed this. I know that Greece has discussed this. These are measures that would make an enormous difference. And so it's not all gloom and doom. There are bright spots here, and humane and sensible and scientifically directed policies are being put forward, and that is encouraging. At the moment, though, looking at the globe as a whole, I think we're in a period of trauma and adjustment and needing to learn the lessons of history and of this pandemic in particular.
And what do you think that we should learn from this pandemic the day after?
Absolutely. I think we need to recognize that this is the first pandemic, I would say, of the era of the first major pandemic of the era of globalization. And globalization seems to mean a variety of things. One of those is our relationship in a highly developed industrial world, relationship with nature. And we now know that our relationship with other species has been falsified as we willy-nilly are destroying animal habitat and deforestation, and that drives increased relationships with the reservoirs of disease in other species that human beings didn't have so much contact with in the past. And bats are a wonderful example and the spillover of that. And so deforestation is a driver of new emerging diseases. And we see that there was SARS, MERS, Ebola. Now we have COVID-19. This is a trend. This is something that's going to continue to happen in a globalized world. And so we need to take control of that process and control deforestation. There have just been wonderful studies of the impact of air pollution as a driver of this pandemic. That's a result of our relationship with the environment. And we need, therefore, to change that relationship because that drives the pandemic. So measures for the Paris Agreement are very important to enforce, to tighten. And so we need global consensus on science in those realms. So green policy, a green economy are essential features. We also see that we have to regulate travel. That's another driver. Another feature is our cities. And I think we need to make them and the way that we work within them so that and then we need to deal with housing and poverty. And as we were saying a moment ago, the access of the poor and the elderly to adequate health care. And then we need to build surge protection into our health system so that doctors aren't asked to deal with emergencies, medical, viral emergencies without protective equipment, without sufficient personnel, protocols, trained personnel, without ICU units and ventilators and adequate supply. So we need to go back to restoring funding to healthcare systems. Those, I think, would be among my list of major priorities so that we cope with this emergency better and we are more prepared for a next wave and a next emergent viral disease that most virologists agree is inevitably going to come in the future. And COVID-19 is the first major challenge, but there will be others.
And finally, how do you believe that societies need to confront the fear that is raised to the people?
One of the lessons, I think, of pandemic diseases over their history is the extraordinary strains that are placed on mental health and well-being as well as physical health. And that if you read Shakespeare's plays, Shakespeare, as an example, Shakespeare lived through a series of waves of bubonic plague, and they left a searing memory with him, and those are expressed in the plays. The word plague is used over and over again to express fear and terror, to strike the audience. Romeo and Juliet, plague and quarantine drive the plot, and it ends in a double suicide. That if you look at King Lear and Macbeth, I think they express the mental landscape of human beings in the time Shakespeare writes in King Lear that there is a great coldness, that brother broke with brother. There were mutinies in the cities, that father broke with son. And so human bonds were breaking down. This is a mental landscape. And we know from SARS that the doctors in SARS experienced PTSD from the terrible isolation, overwork, uncertainty about the future associated with that. And this took the form of depression, of all of those results of mental lack of well-being. And I believe that this is part in this crisis of the messaging, and we have very much underrated the importance of mental health and disease. And even the physicians in the UK or China or the United States report depression, and there are suicides among healthcare personnel, and there were not facilities to help them deal with that, let alone the general population. So I think part of the lack of security is the chaos of the messaging in many parts of the world, in India perhaps, in the Americas, in Brazil, in Mexico, in the United States, where you don't have part of the idea of having a scientific, well-messaged, coherent response is that it orients people in these troubled times. And so it has a huge mental health impact if a coherent, scientific, and truthful response isn't provided to the population, which becomes very fearful. And Dr. Tedros, the Director General of the World Health Organization, said that he was terribly afraid that this virus had in its strain a second pandemic of misinformation, stigma, fear, and terror, and that was one as just as consequential as the physical malady. And so I believe that we actually have to deal with mental health as well as physical, and without clear messaging, clear sense of direction, and respect for science and the truth, we're going to multiply the layers of consequence of this disease for the economy, for our well-being, for these international divisions, and so on. So I think we need to take that very, very seriously.
Your message, your advice for the day after?
The day after tomorrow. I suppose my message for the day after tomorrow, above all, is not to panic, but to realize how serious this is, and that all of us need to put our heads together to be truthful and to be honest and to be scientific and to respect the laws of nature. I think those are critical to being able to cope in this really dangerous time, and that means following the messages about masking, the things that we can do to protect ourselves through social distancing and so on. That is what I would hope we would do. And above all, to remember that this disease demonstrates that we're all in this together, and this affects all of us. And so we need to pool resources, pull together, and express international solidarity.
Professor, thank you very much for this conversation. It was an honor.
Thank you. I've been very grateful to be with you today.
Thank you.